Well, here we are at the end of the day. I'm Aaron Strout, CMO of Real Chemistry, and man, what a powerful day of content we've had. Thank you all for sticking with us. I know that it's hard to, while it's great to hear all this great content, it's a lot to digest and a lot of heady thoughts. What I would like to do, and we'll try to keep this fairly brief, is I know that you've met Mary. She moderated, she emceed today. We'll hear from her in a second. Who you haven't seen yet, probably, but you probably read some of the news about it, is our new CEO. He's a wonderful guy. He just started, I think, last week, Shankar, if I'm not mistaken. But anyway, he's here, and we're going to get some of his observations. His name is Shankar Narayanan. He is dedicated to health equity. He's very much in support of this. We had Jim open it up because it was his baby. Shankar is very much, wanting to keep the legacy going. So with that, why don't you talk a little bit about why you joined, why you're so excited about this, and then maybe we get a few observations from the sessions you were able to watch today, Shankar.
Yeah, thank you, Aaron, and thank you, Mary, for inviting me into this as well. This is a real privilege for me to be here, so thank you. Aaron, to answer your question, I joined Real Chemistry mainly for two reasons. Initially, I thought, right? One was I truly believe that we have the power to save lives in the work we do, right? We're obviously not medical doctors or drug developers ourselves, but the work we do in identifying patients, engaging with them, connecting with physicians, helping them engage with patients, and using data and analytics in powerful ways to do that ultimately saves lives. That's what I sincerely believe. And that's one of the biggest reasons that brought me here. And of course, the people and the culture of Real Chemistry, everyone I've met so far has been wonderful. And we're all so mission-driven and so purpose-driven. So that's exciting as well. But after today's sessions, I would say, Aaron, I think there's a third reason. Right. And that is that I am so proud of our support for health equity. I had a somewhat, layman's understanding of the issues and the problems here, but I think having spent some time with Mary and her team, having talked to Jim at length about this, because I know how passionate he is about this topic, and most importantly, just listening to some of the speakers today and the topics and the discussions today, I walk away even more convinced that this is arguably one of the most important healthcare problems we have in our nation. And I am really proud of Real Chemistry for stepping up and being a leader in this discussion and this important agenda. So that's what I would say about that. I think in terms of today's session itself, Mary and Aaron and everybody, I like to think of three things that I take away from every discussion that I'm in. And so I'm going to share the three things that I took away. The first thing I took away was how important it is for leaders to commit to this initiative and this priority. I had a chance to sit in and listen to the CEO panel, which kicked off the day today. And I was struck by how, whether it was Alexander Hardy or Dr. Wayne Frederick or any of the leaders on that call who talked about the importance of how they needed to lead from the front, right? And so this is one of these issues in our country where I believe we're not going to solve this problem by subscription only. We're going to need sponsorship. We're going to need commitment from leaders. So listening to leaders like that talk about how this is a priority for them personally, the organizational resources they're committing to the problem, the way they're making this goal something that is a goal that is shared by the entire leadership of the organization, those are all things that we can learn. And I think if we're going to make a real dent and in this problem of health equity, that's going to be, I think, a big thing that everybody is going to have to step up and lead, right? And that starts here at Real Chemistry with me, and then it also extends to all of our clients and other participants in the healthcare system. So I would say that was my number one takeaway. The second thing I took away is we cannot achieve health equity without building trust in the healthcare community and amongst healthcare participants. Whether it's payers, providers, drug manufacturers, device manufacturers, whoever it is, every one of us needs to understand where people are coming from, and meet them where they are, right? That's how we build trust. And so this example that Dr. Frederick shared of this patient that he was treating, this is a lady who had 5 children, and she couldn't make her vitally important chemo appointment because she just had to put food on the table for her family, right? And he was so humbled in sharing that story because he was like, look, I was embarrassed to be frustrated with her and sort of mildly admonish her when, I had no idea about her realities and her economic realities and the life she lived and so on, right? So that, to me, that understanding and just being able to fully relate with and being able to fully understand where people come from will ultimately build trust. And I think when we build trust, we will start to bring down the barriers that prevent health equity being a reality. And then the last thing I would say is, this is going to take real investment. I think Jim and Mary talked about this at the beginning. I'm glad to see venture investment going into this. I'm happy to see corporates making real commitments. Tomorrow we're going to hear from Dr. Woodcock about how the FDA is also stepping up here. I mean, it's going to take a wholehearted team effort here with real resources, real dollars, real capital to make this happen. And I feel excited and bullish coming out of today that the needle is moving right in that direction. So those would be, Aaron and Mary, my 3 takeaways, which is we have to lead from the top and show the commitment as leaders. We have to work hard to understand where people are coming from and engender trust. And lastly, there has to be real investment and real dollars and resources going in to address this problem. So those would be the 3 things that I took away. But Mary, I'd love to hear what you've been observing and your perspectives as well.
Yeah, thank you, Shankar. Those were great observations and all very critical and spot on. And so I would just add a couple of things to that. So certainly what we heard about the pipeline and the talent, the people, that the workforce and the physicians and the STEM folks, all these folks that are going to have to help us achieve this over time. And we heard that, Howard University, Howard Medical School, Meharry, Morehouse, Drew can only graduate so many, positions of color. People are going to have to move out of their silos. These other academic institutions are going to have to do their share to make their organizations a place where students of color not only want to come, but can come, get accepted, and then get the support to get through. And so, the comment about the talent in the communities of color is not invested in because that talent is not seen as future doctors and scientists and investigators. So this whole mind reset that we need to have and broaden our view, and certainly, again, organizations, the whole health ecosystem and beyond needs to broaden their view of what you see and who you see as a doctor or a CEO of pharma. So that part is critical. Also, the ongoing bias, we heard a lot about the references to the maternal and infant morbidity rate amongst Black women, and this misinformation and fake news, as one of our panelists said, of trying to make everything seem like it's the fault of the diverse population somehow. But, that is not standing up, certainly with the maternal and infant health morbidity, because you have Serena Williams, who certainly knows her body and takes care of herself, and yet she almost died in childbirth. And it's not about educating folks even more. We're not dying higher in childbirth because of diseases. It's the practitioner's reluctance to treat us and to acknowledge our concerns, our input, and there is segregated care, and it's showing up in clinical trials and lack of diversity. Folks at Real Chemistry know I shared last year when I did the Black History Month about my own experience. My first child died of a crib death at 2 months old. My second child and I both almost died in one of the top hospitals in the country because they left me in the room bleeding when I told them I was bleeding until, I almost died and the baby almost died and they had to run in and rush us into surgery. So it's not about your income level. It's not about your education level. It's not about your geographic location. This is real. And we've been saying this for a long time, and we cannot educate ourselves out of dying in childbirth and our babies dying. So the data is showing that there's a need to be treated by physicians who are empathetic. So I really was pleased to hear that kind of narrowing down on that. And, our vice president has been trying to get legislation passed around that, which Congress has yet to pass. But we're hopeful that now voices like Serena Williams, the tennis player, and others have been added that maybe they'll move forward.
Well, I think to that point, Mary, today was a seminal day. And one of the things that, if you're just watching the video and, you can see it over on YouTube, but I think you probably noticed it, the level of engagement in the chat,
yes,
in the level of people that were engaging, people like Quita Highsmith from Genentech and people like, Dr. Maybach and others, that they're the movers and shakers, and many of them were speaking, and they didn't just sort of drop into their session and drop out. Like, they were there all day commenting and engaging. And I feel like one of the things that was another theme was the honesty, the honest conversations, the getting to the truth of how do we fix this and how do you meet people where they need to. Like, one of the sort of hidden gems for me of the day was with our own Jennifer Paganelli, JPEGs, with Dr. Graham from YouTube and Dr. Fitzpatrick from Grapevine. And they just talked a lot about the impact of that disinformation and how we need to get the right information to people in the channels where they're digesting, which, by the way, looks a lot like this on their smartphones, right?
That's right.
So that was a big deal. And I think that will help move the needle, is when you have leaders that are this engaged, people like Dr. Hardy or Alexander Hardy, who's the CEO of one of the biggest drug companies in the world, showing up for this and telling you this is a priority for us. And like you said, Shankar, leading from the front, committing to, I loved his program, Howard University, FDA, and Genentech, right? That 2-year fellowship. What an innovative program that was. So kudos to you and Joel Jones, who you'll hear from tomorrow morning, as Mary and Joel do a little bit of a recap and a re-intro.
I just want to add one more thing to this, though, the business case for this. At the end of the day, I've worked in corporate America my whole life. So I certainly understand the business value and all of that. And so the point that Dr. Jonay made from CBS and their panel about the business and societal value, $93 billion in losses due to health inequities. That is huge. We've been saying that for a long time. You're leaving a lot of money on the table. Didn't realize it was that much. But then also $42 billion in losses in employee productivity because it's not being addressed and it is adversely impacting employees, and especially employees of color, who can't work or lose their jobs or whatever because of illness. So that's the other piece that we need to remember. There is a societal value and there is a business value and case. And this is why we cannot just let this be a moment in time. This has got to be a movement.
Amen. Yeah. Not just
well
a good
said,
thing
Mary.
to
So
do.
it's not just about doing good. It's doing good and doing well. You can do both.
You can do both. That's right.
And that right there is the mic drop, I think. So Shankar, Mary, thank you so much. Thank you to everyone speaking today, participating, the whole events team, your partner in crime, Joel Jones. So again, everyone will hear from tomorrow as we open up at 11:30 a.m. Eastern time. So make sure you're tuned in, have a action-packed schedule. Shankar nodded to the fact that we have Janet Woodcock, Dr. Janet Woodcock, the acting commissioner of the FDA, tons of other great speakers, our second CEO panel. So thank you everyone for tuning in. Great day today. I think we started the process of moving the needle and we're going to keep moving it tomorrow. And then we'll hear from Shankar, Jim, Mary, and Joel tomorrow at the end of the session. So we'll have even more insights And I'm assuming that Shankar, as a McKinsey man who does everything in threes, will have another 3 for us. So get ready for that with bated breath. So thank you,
I will
everyone.
try. I will try. And thank you to all our real chemistry colleagues. I'm really proud of what we achieved today. Thank you.
Excellent job,
100%.
team. Yay, team. All right, thanks.